Thank you so much for joining us today for the OSMA CE Day and AGM. I am Dr. Shalini Ramsabik, a board member for the Ontario Shelter Medicine Association, and I will be your host for the morning sessions. Before we get started, I would like to tell you a little bit about the OSMA. So the OSMA is a registered not-for-profit. There are currently 79 members and 153 active members on the OSME AVQMR private Facebook group forum. The forum is a collaborative space to share ideas, discuss cases, provide support, and remain up to date on shelter medicine topics. Some recent highlights of its work are fundraising projects such as the Portal Mania, which provided over 10,000 worth of portals to animal shelters throughout Ontario. OSMA also quickly stepped in to help shelters by providing weekly COVID-19 updates relevant to Ontario, which included a recovery planning toolkit used by many North American shelters. OSMA also distributes information on standard of care to our members through regular blogs, medical protocols, webinars, roundtable discussions, and our annual CE events. Please see our website under the tab Members for more information on the various membership options. Today would not have been possible without the generosity of our sponsors. A huge thank you to our gold sponsor, OVC Pet Trust, who are working to improve the life of pets and the people that love them. Thank you also to our silver sponsors, Hills Pet Nutrition, Food, Shelter, and Love Program, the VCA Animal Hospitals, Agena Solutions, Flux Media, and Zoetis. Zoetis has asked us to share a short 1-minute video with all of you. This is such a new technology that OSMA is one of the first organizations to review this video. Apologies, there's no sound because it is so new. If you have any questions, please speak to Gavin Bain. And a little bit later on in the chat, we will add his email address if you wanted to reach out to him about this new product. So I'm just going to open the video here for a moment.
I'm actually not really going to go through a whole bio. I'm a veterinarian at the Toronto Humane Society. I'm also president of the Ontario Shelter Medicine Association. And really, if you want to know more about me, take a look on the OSMA website and take a look at the leadership page. I think Ringworm is much more exciting than me, so I'm going to start with this talk. I've pre-recorded the talk. It's a little bit of an experiment, but I will be here the whole time, and I'm happy to answer questions after the talk, or if something goes wrong in the middle of the talk, I can just pop up. So here we go. This talk focuses on reducing length of stay for animals with ringworm, and the reason for that, of course, is to improve welfare, reduce negative emotional effects on the animals involved, and improve our life-saving capacity. So why is it so important to address length of stay for animals with ringworm? First of all, they come from our most vulnerable populations. Mostly they are puppies and kittens, but ringworm is also disproportionately seen in animals from hoarding environments and cruelty investigations. And that was recently reported by Dr. Emilia Gordon, who you'll be hearing from later on this afternoon. You'll see that all of the pictures in this presentation are of cats, and that is because cats are by far the most likely species to be affected, although ringworm can affect any mammal, and we do see it in dogs on occasion, and very rarely in other species like rabbits or guinea pigs. In general, kittens are much more likely to be affected than adults, and very importantly, they're likely to be affected during their critical socialization period, which is from 3 to 9 weeks of age. Being in a shelter and subjected to this kind of treatment over a long period not only prevents normal socialization from occurring, but it can also create an aversion to people if this is the primary contact these animals have. I haven't addressed this elsewhere in the talk, but this is one of the reasons why it's so important to allow volunteers into isolation rooms. We didn't do this for some years, and we have seen the error of our ways, and we really try and encourage volunteers to go into particularly ringworm isolation rooms, or isolation rooms where there are puppies and kittens that are otherwise really not receiving a whole lot of enrichment and socialization. Ringworm is a superficial infection that never causes severe illness, and it's easily cured or will resolve spontaneously. By contrast, the behavioral consequences of abnormal socialization can create behavioral problems that will affect these animals for the rest of their lives. Cats from hoarding and cruelty situations are often highly stressed, and they might be not well socialized, so the more efficient and rapid their ringworm treatment is as well, the better. A really important consideration in terms of length of stay for ringworm is that most cats with areas of asymmetric alopecia and crusting do not have ringworm. So just by ruling out ringworm, we can in fact reduce length of stay for a whole lot of animals that don't really have it, but that are suspected to have it initially. So none of the cats in this picture actually had ringworm. It's been reported in several places, including by us and Dr. Gordon, as well as Dr. Karen Moriello, that the majority of cats that are suspected to have ringworm do not have ringworm. That accounts for typically 2/3 to 3/4 of all ringworm suspects. So the number of animal care days you can save by not having animals sitting around in a treatment room for 2 or 3 weeks waiting for culture results is absolutely enormous. One of the things about ringworm is it's extremely predictable. So there's no real reason for each different veterinarian or shelter to be doing things really differently from one another. One of the ways to reduce the use of resources and to reduce errors and therefore decrease length of stay is to protocolize and streamline treatment for conditions like this. So this is just an example of our protocols that we have on Dropbox. We have a bunch of images and videos to show people what ringworm is and isn't. There's a callback script in case adopters or foster parents have to be called with the unwelcome news that a cat that they have in their home has actually tested positive for ringworm. There's an outbreak protocol for large-scale situations where ringworm is spreading through the shelter. And then we have a ringworm treatment protocol specifically for animals in homes, so whether that's adoptive or foster homes. Our key ringworm treatment protocol is the one at the bottom, and it's a pretty standard protocol that really rarely requires deviation. We rely quite heavily in a lot of our protocols, and definitely in our ringworm protocol, on flowcharts. I'm not going through this, I just wanted to show you that it's there, and I'm happy to make copies of these protocols available to anybody who wants them. My email is at the end of the talk, and I'm also happy to make the whole talk available to anybody who wants it. It will also be on our website within the next couple of weeks. So we have a diagnostic flowchart for what to do with suspects, when to move them ahead, when to hold them, and when to treat them. And then we also have a flowchart for determining mycological cure. In other words, when can an animal animal be released from isolation and allowed into the general population or sent back to its home or adoptive home. One of the parts of the protocol that we've found incredibly helpful has been to have a dedicated ringworm treatment sheet. We have treatment sheets for a few things, ringworm, diabetes, and some other conditions, blocked cats as well, and they're incredibly helpful. Before we had this treatment sheet, we would find that even routine processes like taking weekly fungal cultures or dipping twice a week would sometimes be missed, and that could substantially increase the animal's length of stay and increase the time to cure. So these treatment sheets have all of the ringworm treatments on them, spaces for monitoring, as well as timing of the cultures. They also have the doses of the common drugs so that the techs don't have to go and look those up somewhere else. There are a number of diagnostic techniques for ringworm, and to the extent that there's a gold standard, that would be fungal culture. I'm going to run through these relatively quickly. The lesion check is a screening test. It's actually incredibly useful and really just means checking the hair coat for areas of alopecia and crusting. The Woods lamp, another screening test, looks for fungal metabolites that fluoresce on the hairs and can actually be used as a diagnostic test if there is convincing enough fluorescence. Both of these are instant and don't cost anything for the specific test, so that's really helpful. The DTM plate culture is the culture type that's recommended, can be very inexpensive in-house to relatively expensive sent out to a diagnostic laboratory. The cultures take 1 to 3 weeks before you can be sure that there's a negative. So we generally call microsporum at 2 weeks and trichophyton at 3 weeks. So that's a long turnaround time, and that's their primary disadvantage. Their sensitivity is very high if sampling technique is correct, and the fungassay culture is much more prone to false positives because the fungus is not speciated and red color changes can occur for other reasons than dermatophyte growth. The PCR test is relatively expensive. It identifies DNA from both viable and non-viable fungus and can obviously identify very, very tiny amounts. So that's the reason that the specificity is not all that high, because it can identify non-viable DNA or very tiny amounts of fungus that are not an infectious disease risk and not causing clinical disease. We've been using lesion checks a lot more in the past few years than we did years ago. They're obviously a very inexpensive tool and they give you an immediate result. It's quite important to make sure that technicians and veterinarians have at least some training in how to do an effective lesion check, because the last thing you want is to think that a cat is lesion free and then have it spreading ringworm all over the place. We have a video as part of our protocol and training materials, and it's pretty straightforward, but certainly worth having the staff watch it. And we used to at one point run a lot of tests when animals had been exposed to ringworm, and we have now switched to a system where, unless there's a very, very high level of risk, we simply do weekly lesion checks for 4 weeks, and then we can confirm that they don't have ringworm. If the animal is a low-risk exposed animal, it will be moved through to an adoptive home regardless, and we will just give a disclosure to the adopter. So just some examples of where lesion checks are useful and perhaps some limitations. Obviously, in this photo on the left-hand side, there's no mistaking that this paw has almost certainly got ringworm. However, if you look at that area above the paw, that's pretty subtle and it would be easy to miss. So just important to know that the lesion check is not a sensitive test. If you look at the ear on the right hand side, this one is pretty obvious, but they often aren't. And crusting on the inside of the ear margin, like this little bit of scaling on the inner pinna, those are quite common, and those can easily be missed unless staff are really looking in the right areas. As far as the Woods lamp is concerned, I think everybody knows this, but just to repeat very quickly, A black light is an ultraviolet light and not a Woods lamp. It doesn't function as a Woods lamp and shouldn't be used instead of one. You need a 365 nanometer wavelength and a plug-in type lamp. This lamp on the right hand side is the one that's recommended in the consensus guidelines because it has built-in magnification, so it's easier to see lesions compared with the one in the middle. So as I said before, Woods lamps can often result in false positives if people aren't experienced enough to know what they're seeing. So a lot of things can look kind of yellowish or greenish under a Woods lamp. One of the guidelines here is that if there are no skin lesions and no crusts, then that is not going to be a true positive Woods lamp exam. It really has to be associated with areas of alopecia or crusting. So you do get this kind of thing from urine, doxycycline, a whole lot of other things, some eye medications and so on. So as compared with that kind of equivocal, not very bright yellowish color in the previous slide, these are true Woods lamp positives. So the image on the top left, that's what we, I guess, would all hope we would see, and then life would be really easy. So we've got multiple areas, they're quite large areas, and there's this very distinctive sort of blue-green fluorescent color. What we tend to see, certainly in our environment more frequently, is more subtle areas that are fluorescing. So the ear in the middle there, that's pretty obvious, but it could also be quite easily missed, especially those smaller areas further up on the pinna that may only have a few hairs that are glowing. And then this paw on the bottom right, you can see there is some fluorescence, and that's true fluorescence. The image doesn't show it very well, but it also wasn't all that obvious under the Woods lamp. So you really do need staff who are trained to both see fluorescence that's really there and not see fluorescence that isn't really there. The sampling technique for culture and PCR is pretty straightforward. The major pitfalls of sampling is firstly not to be collecting hairs from the affected areas and then ending up with a false negative result, and also to be using contaminated equipment and toothbrushes that haven't been individually packaged, so could be contaminated before collection. So we toothbrush the non-lesional areas first, followed by the lesional areas to avoid spreading ringworm over the whole cat. And we make sure to brush the whole cat from head to tail, and quite a lot of brushes, probably 20 or 30 per cat, making sure that you end up with quite a lot of hair in the toothbrush. We pluck the most obvious lesions, and it's important there just to know that you need more hairs, bigger sort of plucks, as well as more hairs in the toothbrush for PCR compared with culture, because the PCR requires hair follicles, and if that's not present in the sample, again, you could get a false negative result. The lab does tell you if there's insufficient sample, so it wouldn't just be reported as a negative, but it does lead to a delay in the results. So the IDEXX PCR panel has turned out to be a very, very good test for initial diagnosis of ringworm. We did a study of this test shortly after it came out and published the results in 2017. The results of PCR testing for ringworm and their validation is relatively lab specific. So while it's likely that other veterinary labs have got reliable PCR panels, to my knowledge, those have not been independently tested, and those results have not been independently published. So what I'm saying about PCR tests currently refers to the IDEXX test. So we found when we compared PCR and fungal culture for diagnosis of ringworm, initially when suspect cats were presented, that it was an excellent test for diagnosis, and it identified all of the culture positive cats. There were also some false positives, and that's to be expected because it's an incredibly sensitive test. So it's also going to pick up non-viable DNA on the cat's coat, and it will also pick up tiny, tiny amounts that are clinically irrelevant. This kind of thing is much more of an issue when you have a group of cats from the same contaminated environment. So just like any other test, the PCR test needs to be interpreted in the context of the history and clinical signs. and a positive result shouldn't just always be taken to mean that a cat has ringworm for sure. If the result might be a false positive and you didn't really think it was likely to show up positive, but it did, then it's very useful to ask for the CT value from the lab. That's a measure of how much DNA is in the sample. The lower it is, the more DNA. So in our study, we found that somewhere over 35.7 CT values were always culture negative. That's clearly not going to be the case in every situation. But if your CT value is in the region of 35.7 or above, and especially up at sort of 38, 39, which is close to the negative cutoff, then it's fairly likely, if the cat doesn't fit clinically, that it's a false positive. So we did find also, and this has been confirmed by others, that the PCR test is not reliable to confirm cure, and that culture should be used for this purpose. It's very important because there are people who just do weekly PCR tests, and that will mean that the animals are often held in isolation and treated for much longer than they need to be. So the PCR test will continue to pick up tiny amounts of fungus and tiny amounts of DNA, as well as they will pick up non-viable DNA. So the culture will be negative, often many weeks before the PCR will be negative. So just to summarize there, we will use the PCR test to confirm the diagnosis, but we'll use culture to confirm cure. I've already said this, the PCR test should not be used to confirm cure. It's expensive and it can very substantially increase the length of stay. So in our shelter, the use of the PCR test has dramatically reduced our length of stay and animal care days for cats suspected to have ringworm. And remembering that 2/3 to 3/4 of cats that are ringworm suspects are in fact negative. So that whole large number of cats gets moved through our system very, very quickly now. They don't hang around waiting for culture results, and they also don't take up an enormous amount of staff, time and resources, as well as the cost of treatment. So we do the Woods lamp for anyone coming into the shelter. If a Woods lamp test is definitively positive, and there's no doubt about that, that is our initial diagnostic test. So we won't go ahead and do any other confirmatory tests if it's a very clear Woods lamp positive. That's already a big saving of time and money. If the Woods lamp test is negative in a ringworm suspect, we'll do a PCR test, and then we get that result within 1 to 3 days. So 11 to 12 days or more sooner compared with culture. The exact timing depending on whether it's most likely to be Microsporum or Trichophyton. So there's minimal or no treatment in a lot of these cats while waiting. Very often our ringworm suspects are kind of equivocal and we just want to test to be on the safe side, but we don't really think they have ringworm. So a ringworm suspect might have anything from being moved into isolation with a full treatment, or just be waiting behind a little barrier in adoption with some special PPE measures, or they might get a single dip while they're waiting. That's really helpful, and it saves us and the cats thousands of days of isolation time. So looking at these poor kittens that are just desperately trying to get out of their cage, what else can we do other than rule out ringworm very, very quickly and then try and confirm cure as efficiently as we can? One of the things that we can do is to use P-scores to clear dust mop or fomite carriers from isolation much more quickly, as opposed to keeping animals in isolation for weeks and weeks if they're just culturing with one colony, which really isn't significant. So this system, I'm sure you're all familiar with it. I'll just recap quickly. P1 is 1 to 4 colony forming units or colonies per plate. P2 is 5 to 9 colonies per plate, and P3 is 10 or more colonies per plate. So if an animal cultures with P1, generally speaking in these situations, because they've had a culture, they'll already have been treated for a couple of weeks, and your P1 is really 2, maybe 3 weeks in the past. So that's already a lot of insurance that even if they do have a little bit of fungus on them, it's probably gone by now, and in any case, it'll be too little to be infective to anybody else. Important to take lesion checks and Woods lamp results into account when deciding. And then again, important to know that the Woods lamp will pick up fluorescence in the hairs, and when an animal is recovering from ringworm, the hair tips will glow because this metabolite grows up with the hairs. So that's not a problem. What you're looking for is a Woods lamp positive down at the bottom of the hair shafts. Very important again not to keep an animal in isolation because the hair tips are glowing. So if they have negative Woods lamp of the hair shafts and they're non-lesional with a P1 score, they can be considered dust mop or cured, and they can be moved ahead. There's some new information about fungal cultures that will also help us to move animals through the system more quickly and more efficiently, and also helps to make fungal cultures easier. So one is a study by Dr. Leonard Attar from Cornell, and then Dr. Moriello's consensus review has some really nice summary information about techniques. So in the Attar study, they found that 100%, which is pretty impressive, of about 200 diagnostic plates for cats with Microsporum canis had colony growth before 7 days, with a median of 4 days. So the implications of that is that for a truly infected cat, if you don't see growth within 7 days, you probably don't have a true positive. You can't be 100% sure, but it really does help to get things moving much more quickly. For cats that were fomite carriers, in other words, had P1 cultures, most of them showed growth before 12 days with a median of 5. So that growth could still happen pretty early, but it was typically later. And this is quite useful if culturing is being used at that first sample to diagnose or rule out ringworm. It's less helpful for subsequent cultures because in our experience, the growth is much slower in subsequent cultures because you've damaged those fungi. So I don't think there can be a reasonable expectation of growth within 3 or 4 or 5 days on cultures during treatment. The Moriello consensus review summarized some recent findings about fungal culture. It can be done relatively easily, and the conditions under which the fungus is grown are not that critical. So it will grow at room temperature as well as 30 and 36 degrees C, and it will grow in the light or the dark or a mixture of the two. So what else can we do for these cats with ringworm? Well, sometimes we can't reduce the duration of treatment, but what we can do is we can reduce the length of stay in the shelter. So ringworm fosters are quite common now, and we started doing this a few years ago, and it's been reasonably successful. Obviously, not every foster parent is going to agree to take in kittens with ringworm, but a surprising number will. So Laura Mullen at San Francisco SPCA has got a whole training course to teach people how to have a ringworm foster program. What we did was we created a very kind of light-hearted, non-threatening, but accurate and informative talk for any foster parents who might be interested in fostering ringworm. So we started off with a little bit of a joke. We added some information really just to emphasize the low risk of ringworm. Really that ringworm never killed anybody. It doesn't cause severe illness. Even in immune suppressed people and young children, it can certainly be a nuisance, but it never causes severe disease. And we kind of demonstrated this by showing that sulfies cause 28 deaths a year, and there's some very other strange causes of death, and by comparison, really ringworm is not scary. We also at that time, pre-COVID, baked a ringworm cake that my daughter decorated, and we had people eating the ringworm, which it's kind of cute, but it also really does help to reassure people that this is not a very scary and deadly disease. So one of the things that really puts off foster parents is the onerous nature of environmental decontamination, and also that they're afraid that there's going to be spores in the environment the way we used to be taught, there are spores in the environment for months and months and months, and people think that that's going to give them and their pets ringworm. So it's really been established in the past several years that ringworm is primarily transmitted through direct contact. There's only been one case report of a child who transmitted ringworm from the environment. Definitely not to say it can't happen, but it's much, much less likely. So our colleague here, Dr. Balinoff, with her cat over her shoulder, she's much more likely to get ringworm than I am walking through a room where my foster kittens have been. There was a study that Dr. Moriello reported where they looked at 70 foster homes and they cultured the homes after they'd been decontaminated. What was interesting here was that for a week or 2 or 3 after the cats were released and the home was decontaminated, there was still fungal contamination in 32 out of 70 of those sites, but there was no transmission to pets or people. Laundry for ringworm is not particularly problematic. What's recommended is 2 regular washes on the longest possible cycle, but no other special measures need to be taken. Carpets are a different matter. They are quite difficult to decontaminate, so we do recommend that foster kittens with ringworm should be kept in areas without carpets, and the toys are plastic and everything is easy to wash. But even if cats with ringworm have been in a carpeted area, it's not the end of the world. It might be very difficult to remove all of those spores from the carpet, but that might not really matter. So in general, vacuuming and mechanical cleaning and then cleaning with detergent are really the most important decontamination steps. So we still do recommend disinfection, and we have our foster parents doing that, but most of that fungus is completely cleared away just by cleaning and washing with detergent. In terms of cleaning and disinfection, the one place to be really, really careful about is the vacuum itself. You're obviously concentrating all those ringworm spores in one spot, and sometimes the vacuums are blowing out the spores even though they shouldn't. So really, really important to replace the vacuum bags frequently, clean the vacuum mechanically, and then disinfect. Otherwise, you could have a situation where foster parents are being infected, other animals are being infected, or in the shelter, the vacuum can certainly be the cause of a shelter outbreak. So treatment for ringworm, there's a pretty standard best practice for shelters that I think just about everybody uses, and that consists of oral itraconazole or terbinafine. Itraconazole should be non-compounded, so generic itraconazole is okay, but the compounded form is not well absorbed. Terbinafine is much, much cheaper than itraconazole, so it's recommended really from a resource perspective, but both of them work equally well. They should be used for 21 days, either consecutively or 7 days on, 7 days off, for a total of 21 days. And then the systemic treatment is always combined with topical treatment, and currently the best practice topical treatment is the use of lime sulfur dips twice a week. There have been some recent concerns about topical treatment because lime sulfur is no longer being made by some of the manufacturers in the US and hasn't been available through distributors in Canada for a while now. Lime sulfur and Mavorol are the ideal topical treatments for ringworm because they are the only ones that have residual action, and that results in more rapid negative cultures and therefore more rapid determination of cure and release from isolation. Lime sulfur is no longer distributed in Canada, but we can get it compounded through Chiron. It's also available online or through emergency drug release. The ASV recently released some guidance about lime sulfur, and the general feeling is that it will probably remain available in the US and also will remain available for compounding. One of the main features of lime sulfur is this residual effect that it has. So there should not be any viable spores on the hair coat for 3 or 4 days after each dip. Dipping is quick, which is another tremendous advantage of lime sulfur, and then the side effects are generally very low, although it can sometimes be irritating to the skin. The concentration that's recommended for shelters, and I think that most shelters use, is 1 in 16 or approximately 6%, but that's actually anecdotal. It's thought to clear ringworm quicker, but that hasn't actually been demonstrated in a controlled environment and hasn't been published. So it may be possible, especially with the increased cost of compounded lime sulfur or just difficulty accessing lime sulfur, it might be possible that we could get away with maybe 3 or 4% solution, but we just don't know that for sure yet in the shelter environment. If lime sulfur is scarce, certainly the same mixture can be used in the same day. Obviously it's killing the spores, so there's no transmission risk there, and it might be possible to keep it for longer, although it's a little bit gross potentially, but if it's not heavily soiled, it might be possible to use the same lime sulfur solution more than once. One thing that really requires clarification is what is actually in the compounded lime sulfur and how it should be diluted. So the Chiron product says lime sulfur 23% and calcium polysulfite 23%, but the consensus guidelines say that calcium polysulfite 23% is actually equivalent to 79.9% lime sulfur. This has very significant implications for how this product should be diluted, and they are stating that it should be diluted at 1 in 16. So definitely some clarification would be needed from the manufacturer as far as this is concerned. Alternatives to lime sulfur are out there, but there isn't anything that's as good, and that's basically because nothing else has residual action. So there are various shampoos, mousses, and rinses that can be used, but that will lead to a slower time to cure. The main reason for that, again, is not necessarily because cure is slower, but because cultures will stay positive for longer. So what happens is the spores build up on the coat between applications, and then if you culture just before the next treatment, you're much more likely to get a positive culture. The other big disadvantages to these products is it takes longer to apply them to the animal, and there's generally more steps involved. So the one that has the most evidence at this point is Miconazole chlorhexidine shampoo, and that is a 2% concentration of both. The combination is important. Miconazole on its own or chlorhexidine on its own isn't as effective. So this is the one we have the best in vivo evidence to date, and there have been several studies done. It's also has a manufacturer's label as an adjunctive treatment for ringworm, and it's recommended that you shampoo it into the coat, leave it for 10 minutes, and then rinse and towel dry. The other alternative contender for topical treatment is accelerated hydrogen peroxide shampoo, which is available as pure oxygen shampoo. Of course, we all know that accelerated hydrogen peroxide itself is a phenomenal environmental disinfectant, and switching to AHP many years ago was one of the best things our shelter ever did. But as far as using it as a treatment for ringworm, there's still a lot of unanswered questions. We often get queries about using this product, and a lot of shelters are probably already using it, but there are no clinical studies to date, even though it has been shown to be effective against dermatophytes in vitro. So as a result, there's no label claim, and we aren't all that clear as to the optimal concentration and frequency. Preliminary suggestions are to dilute the concentrate 1 in 10 and use it twice weekly. 3 times a week has also been suggested, but it might not be practical for shelters. AHP only needs a 5-minute contact time compared with 10 minutes for Miconazole chlorhexidine shampoo, so that would be an advantage. And there is also a special applicator now for use on hair coats, so that would make it easy and convenient to apply. Current recommendations are to rinse with the same solution after a 5-minute contact time and then air dry. So randomized controlled trials comparing lime sulfur, chlorhexidine, miconazole, and accelerated hydrogen peroxide shampoo are really necessary, and hopefully we'll see something happening in that regard over the next year or two. So the one thing we haven't done much of, but that really should be considered, is the adjunctive use of localized topical cream or ointment. So it would just be very easy to have a tube of clotrimazole or miconazole cream in the isolation room, and that's helpful because it has residual action in the area that it's used, And those can just be useful for those little awkward areas that are difficult to reach with a dip or shampoo. So if you have a skin lesion right next to an animal's eye or something like that, this can just be a very nice little addition, but definitely shouldn't ever be considered all by itself. So how do we confirm cure in ringworm as quickly as possible to move that animal ahead as soon as we can? I think everybody also is aware that in the shelter context, we do weekly cultures, and that just allows us to clear animals as soon as they become negative, as opposed to waiting a month or 6 weeks, the way you would do perhaps with an animal in a home, to reduce the costs of testing in that home environment. So culture should be done just before dipping or shampooing, and that reflects the highest possible count. Again, the big disadvantage of the shampoos, which don't have residual action. As I said before, history and skin lesions should be taken into account when interpreting cultures. So if you have a negative culture, but the animal is still covered in lesions, or they're getting worse, that means one thing. If you have no lesions whatsoever, but you have a positive culture with lots and lots of colonies, that should be something that you would be wondering if there's maybe contamination of your instruments or something else going on. Historically, mycological cure was defined as 2 negative consecutive weekly cultures, and we have been using that definition for many years now, but we have recently changed that definition as a result of some new research. So this was very exciting, got us jumping up and down a little bit. It was a publication from Drs. Stuntebek and Moriello, comparing 1 versus 2 negative fungal cultures to confirm mycological cure. It's a very nice study and very helpful. So what they did was they looked retrospectively at 371 positive cats and found really strikingly that 90% of them were negative after 1 negative culture, meaning that once a culture was negative, the subsequent culture was also negative. They had 10% that were negative and then positive. They thought about 5 of those were sampling error. So that takes us to 95% of them that culture negative and are negative. And about the other 5% had concurrent disease. So as far as concurrent disease is concerned, that means things like maybe diabetes, immune suppression, something that would be making a cat more prone not to resolve its ringworm, as opposed to an animal with a little bit of URI or something else that really isn't relevant to ringworm. So you're really looking at something that would affect the immune response and the ability to recover from a skin disease like ringworm. So in the course of the discussions with Drs. Stuntebek and Moriello, where we were asking them if they thought that it was safe to switch to 1 negative culture for most cats, made this very fascinating discovery, which is that this whole recommendation for having 2 negative cultures was simply defined in a 1959-1960 paper about chronic ringworm in Persian cats, and they were treated with griseofulvin at the time, not any of the drugs that we use now. So that wasn't really supported or justified, it was just stated, and we've been doing that ever since. So we felt that it was perfectly reasonable to make a change based on new data. So that's pretty much what I have to say. I'm just going to summarize briefly how to reduce length of stay and maximize welfare for cats with ringworm. First of all, use protocols because they save lives and they minimize error, and that reduces length of stay because you can get the animals through the system and out as quickly as you can. Very important to rule out ringworm as quickly as possible, and especially out rather than in, because that means 2/3 to 3/4 of cats can move ahead quickly once they've been determined not to have ringworm. Lesion checks are an excellent tool. They don't cost anything, and they're very, very helpful for screening and for rechecks. Lime sulfur results in the most rapid cure of all the topical treatments and should be used if it can be obtained. And then, especially for kittens, ringworm foster for socialization and welfare is very, very important, and ringworm foster programs are really well worth doing. And finally, it's perfectly justifiable to use a single negative culture to determine cure for cats that are otherwise healthy and have no predisposing factors to suggest that they might actually recur or not clear their ringworm properly. Here are some suggested resources. As I said, I can make this slideshow available to anybody who emails me about it, and it will be on our website in the next week or two. That brings me to the end of this presentation. This is my cat, Mr. Purr, demonstrating various forms of in-the-box and out-of-the-box thinking. I hope that this talk has been helpful and has provided useful tools to ensure that shelter animals don't remain in the shelter even a day longer than they need to and can move more quickly to their forever homes, as Mr. Purr did many years ago. All right, so I see there are a couple of questions. I think Shalini is still behind a power failure, so I'm just going to go ahead here. The positive whiz lamp images shown do not appear to have the characteristic apple green or blue-green color one would expect to see. They look the same as the negative examples. How does one visually differentiate positive versus negative fluorescence? It's an interesting question because that apple green is something I've often wondered about. Like, I don't really see those as apple green, and I'm not sure which part of the apple sometimes they're referring to. I think the thing about a positive woods lamp image, they're hard to photograph. When you see them, there's kind of like a bright active fluorescence. It's not just a color change, and they are more blue-green than yellow. So if it's a kind of a flat, dull yellow, I'd be very suspicious of it. You also want to look at where it is. So can it represent potentially compounded doxycycline around the mouth, or might it represent urine if it's in the perineal area? And then, as I said, the other clue is whether it's actually associated with skin lesions or not. Another question is, can you expand on Amaverol more, or does the same principle for Lyme? Amaverol DIs more, or does the same principle for Lyme sulfur apply? I'm not sure I understand the question, but essentially Amaverol is equivalent to Lyme sulfur in terms of its efficacy. It hasn't really been recommended in American literature because it was only available here, but it's no longer available here. But we certainly would use Amaverol or Lyme sulfur interchangeably. And it was a really nice, it was also a very nice product to have for foster homes or adoptive homes. And let's see if there's anything else in here. What percentage of incoming cats have been found to have ringworm? So there was a study done in the southwestern Ontario some years ago, maybe 4 or 5 years ago, that I believe they just sampled all cats, not just suspects, and they found out of, I think, 300 cats, there were no positives. So it's not common in this part of the world. We see it mostly in hoarding situations, overwhelmed shelters or hoarding shelters, that kind of thing, more sometimes in cats that have come from colonies, but it really isn't common. I don't recall the numbers in Dr. Gordon's study. I think it might have been a little bit more common. It's mostly, it's more common in warmer areas, so generally further south, but we do see it on a regular basis. How long does it take from the time of diagnosis to time being cleared by culture? So again, because we don't really discriminate or haven't up to now between P1, P2, P3 positives. So a lot of ours clear very quickly. We'll find that the first culture is negative and then they continue to be negative. Sometimes they can be positive up to 5, 6, even 7 weeks. That's really rare. So I'd say typically 3 to 5 weeks from the start of treatment to the second negative culture. So we'll be taking a week off that from now on because of only using one negative culture. Struggle to, when you get animals from hoarding situations, maybe 1 or 2 cats will have Woods lamp positive lesions, others will be negative. How do you handle the negative cats since they are at risk? Do you keep them for observation? Do you treat preventatively? Yeah, that's a really good question, and it's a problem. The one thing I'd say from our experience is don't over-diagnose and over-treat the negative cats. So what we tend to do there, first of all, when we have a cat coming in as a group from a particular place, we keep them as a cohort in the same room. And we don't move them around the shelter, and we don't move them out of that room until we're sure that whatever infectious diseases we're concerned about are under control. So in that kind of situation, what we would do is we would carefully lesion check every cat. We would move the strong suspects into isolation and treat them as ringworm positives until we have a culture result. That's assuming they're not Woods lamp positive. And then we would dip all of the other cats at least once in the room, and then depending on what we think the level of threat is, we might continue to dip or not, and then we would do lesion checks once a week. So if we're reasonably happy that they probably won't have ringworm, after a couple of weeks we would move them ahead, potentially to surgery and so on. We would do all of them at the end of the surgery day, make sure everybody's aware that they might be carrying ringworm spores, potentially even dip them the day before. So we would take appropriate precautions to make sure when they have to be moved down to surgery, we're not going to have contamination of the rest of the shelter. And then after that, or if they're already spayed and neutered, we would make them available for adoption with a disclosure. So we let the adopters know that there's a small possibility of ringworm. We discuss it with them, and then they can go ahead. While they're in the shelter, we would lesion check them once a week for 4 weeks. I think those are all the questions. Let me just see what's happening in the chat. How would you treat trichophyton positive? Yes, just the same as MK-ness. I haven't seen any reason to treat trichophyton differently from MK-ness. The big thing about it is just it's less common, but the treatment is the same. You just have to run the culture for 3 weeks. If you get an initial trichophyton PCR that is positive. The one thing I'd say about species is that Microsporum gypsum, in our experience, does not seem to be particularly contagious. We had one cat that had it on its tail for weeks and weeks and weeks, and nobody realized, and nothing ever happened to anybody else. So that's the one I'd kind of be interested in. The other thing about trichophyton is, in our study, we had very, very few of them, but I got the impression that you're more likely to have a false positive result with trichophyton, like a true false positive. We had a couple of cats that just didn't seem to have anything, and they tested positive for trichophyton with a very low DNA count on the PCR. Dr. Gordon is saying MK-ness in their study was 0.25%, trichophyton 0.055%, also very low compared with other studies, and quite a lot of their cases with trichophyton. So obviously that would just depend on where the cats are getting it from. Dr. Hughes, there's debate about whether oral itraconazole is better absorbed with and without food. Sporanox is better absorbed without food, oral itrafungal with or without food. We've been using oral itrafungal with tasty baby food mixed in. I have seen that it should be given with food. I wasn't really focused on that. Those consensus guidelines, by the way, have got everything you ever wanted to know about dermatophytosis, and that certainly is mentioned in there. I don't think in our shelter that we particularly worry about giving it with food. So definitely it works regardless of how you give it. I think the big thing is not to use the compounded itrafungal. just looking, these questions seem to pop up in some odd places. Okay, I think we've covered the Q&A. Okay, I think we are done with questions. Thank you so much for all these excellent questions and for being here today. We will have a 15-minute break, and then we'll introduce Dr. Hutchings and her dental panel team a little bit after that.